President Trump is reportedly considering downgrading marijuana's drug class to classify it as a less dangerous drug. It would be part of a wider push to ease restrictions on the drug, as 24 states and Washington, D.C. have legalized recreational marijuana. Here to weigh in on this is Fox News senior medical analyst Dr. Mark Siegel. Hey, Dr. Siegel.
Great to see you.
Good to see you. What do you think about this?
Well, you know, President Trump has always been very reluctant to get involved in this because of his brother Fred, who died of alcoholism in his 40s. So he's coming at it from the right place. Caution. The problem here is that marijuana and cannabis are becoming more and more potent all the time, because it's not just taking the leaves. They extract the THC and it becomes very highly potent, and you see more overdoses. 22,000, most of them kids, going to the emergency room last year alone from cannabis overdoses. People eating gummies, they're taking them by mistake. It's a problem, but it's possible. And I wrote in the Wall Street Journal a few months ago, this is not your parents' Woodstock weed. In other words, this isn't what we had in the 60s. It's way more potent. But it's Schedule 3 now, which is the same as heroin. Now, you look at fentanyl, which we know is bad for you and it has very little medical use, except if it's in the right doctor's hands. That's Schedule 2. Marijuana, cannabis is Schedule 3, like heroin. So some people say maybe it should be Schedule 2 or Schedule 1 so we could do more research on it. I think that's a good argument. My problem with it, Ainsley, though, is that more and more people will use that as impetus to make it legal. 40 states, it's medical. 24 states, it's recreational. And more pressure to make it where doctors don't have to be involved. That's what I'm worried about. You smell it in the streets. It's really powerful. It's causing car accidents. Got a big downside.
All right, let's talk about topic 2, which is Ozempic and all of these semaglutides. They just tested Ozempic to see how it affects aging, and apparently it shaves off about 3 years of your life if you're on it, the patients that were on it. The ones who had the placebo, not the case. But I think this is true, and you explain this, for all semaglutides, right?
Exactly. Wegovy, Ozempic. It's a company called Tri-Diagnostics in Kentucky that really looked at it over about 9 months and said, wait a minute, your biological age, the amount of inflammation, the amount of fat you have in your body went down the equivalent of 3 years.
Yeah.
Now, Jelly Roll, I don't think you're taking it, by the way. I think you did all this naturally. Jelly Roll was just on, right?
Yeah.
But here's the good thing about it. It's good for your heart. It's good for your brain. It's good to lose weight. It's good for your sugar metabolism. I think we need more research, but it really looks like it's an anti-aging drug in a very positive way.
So it was everyone who participated in the study that had the Ozempic, they were 3 years younger than they should have been? Or
at the end of 9 months.
Were 3 years
well,
younger?
Not 3 years physically, like, oh, I'm not 80 now, I'm 77. It's more like your body itself was 3 years younger in its metabolism. Less fat, less inflammation, functioning better.
That's great. Is it because they lost weight and they're healthier?
That's part of it, because the weight is part of the inflammation. Now, there's a downside here. There's side effects to these drugs. They got to be prescribed by the right doctors. It's got to be in the right hands. This isn't something you want to get from some candy machine somewhere. That's the other part of this. We need long-term research on it, too.
What do you hear from your patients?
Well, sometimes there's eye issues with it. There can be thyroid issues with it. There can be GI issues. Not everybody tolerates it. It's not for everybody, but certainly it's for people that have a lot of weight to get off. Obesity is the biggest epidemic, as Make America Healthy Again is saying. We have an obesity epidemic, but doing it naturally is the place to start.
Okay. Dr. Siegel, thank you so much.
Great to see you.
Great to see you.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhardt. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.